Get her off my floor, now! Melissa's voice cracked like a whip across the ER. Avery Knox didn't flinch. She just set the folded linens down, slow and careful, the way you set down something that might break. Every nurse in the hallway stopped. Every monitor kept beeping. And nobody knew that in 4 hours a Navy helicopter would land on that very roof and a decorated commander would step out and ask for Avery Knox by name. Before we go any further, please subscribe to the channel. Follow this story all the way to the end and drop the city you're watching from in the comments so I can see how far this story has traveled. Now, let's begin. Avery Knox arrived at St. Gabriel Medical Center at 5:43 in the morning, 17 minutes before her first shift officially began, and she already knew she could feel it in the way the night nurses glanced up and then glanced away that she was not going to be welcome here. She didn't mind. She had been unwelcome in harder places than them. She signed in at the front desk. The receptionist, a woman in her 60s with reading glasses on a beaded chain, looked her up and down once and said, "New one? Yes, ma'am." The receptionist slid a badge across the counter without looking up again. "Try not to cry on the first day." Avery took the badge. "I'll do my best." She clipped it to her scrubs, plain navy blue, no pins, no ribbons, no anything, and walked down the long hallway toward the emergency department. Her shoes made almost no sound on the polished floor. That was a habit. A person could learn a lot about how to move quietly when they'd spent years moving through places where noise got people killed. But nobody at St. Gabriel knew any of that yet. The charge nurse that morning was Melissa Harper, 42 years old, 15 years in the ER, and she ran her department the way a drill sergeant runs a barracks, loud, proud, and absolutely certain that every new hire was an idiot until proven otherwise, and most of them never got around to proving otherwise. Melissa looked up from her clipboard when Avery walked in. She looked her up and down the same way the receptionist had. Then she said loud enough for everyone at the nurse's station to hear, "You the new one? Avery Knox, reporting, ma'am." Reporting, Melissa laughed once short and flat. "Honey, this isn't the Army. You don't report. You clock in. Did they tell you what floor you're on? Emergency department rotation with preoperative support." "Wrong." Melissa tapped her clipboard with the end of her pen. "You're on linens and prep, that's it. You touch a patient without me telling you to, and I will personally walk you back out that door. Understand?" Avery nodded once. "Yes, ma'am." "Stop calling me ma'am." "Yes." A younger nurse behind the counter, blonde early 30s name tag, said. Brittany snickered into her coffee. A respiratory tech leaned over and whispered something, and Brittany laughed harder. Avery kept her face completely still. She'd been laughed at by harder people than these. The first hour she folded linens, sheets, pillowcases, blue surgical drapes, the kind of endless white mountain that they give new nurses to see if they'll crack. Avery didn't crack. She folded each one the same way, tight corners, precise edges stacked by size. A senior nurse walked past, glanced at the stack, and said, "Who taught you to fold like that?" "I picked it up." "From where?" Avery smiled a small, closed smile. "A job I used to have." The nurse waited for more. Avery didn't give it. The nurse walked off muttering something about weird new hires. In the break room at around 7:30, Melissa was holding court. Avery could hear her through the open door as she restocked a supply cart in the hallway. "I'm telling you," Melissa was saying, "I can smell it the minute they walk in. This one 3 weeks, maybe 4. She's got that quiet little church mouse thing going. Those are always the ones who fall apart first trauma they see." "Where'd she come from?" That was Brittany. File says she did 2 years at some community clinic in Montana. Before that, I don't know, gap in the resume, personal stuff probably, you know the type. "Yeah, I know the type." Brittany laughed. "Bet you $10 she's in tears by Friday." "Make it 20. Done." Bree, standing in the hallway, kept stocking the cart. She slid a box of 18-gauge IV catheters into its slot, then a box of saline flushes, then a box of gauze. Her hands didn't shake. Her face didn't change. But somewhere way down deep in the quiet place where she kept all the old things, she made a tiny mental note, Melissa. Brittany, $20. She'd remember. At 8:15, she was asked to help wheel a preoperative patient, an elderly man named Mr. Alvarez, going in for a hip replacement, down to the surgical holding bay. She walked beside the gurney listening to him talk. He was nervous. His wife had died 2 years back. He hadn't been under anesthesia since Vietnam. They put me under once in '69, he told her. Shrapnel in my leg. When I woke up, I cried. I never told anybody that. I cried like a baby. That's not weakness, sir, Avery said quietly. That's being alive. He looked up at her. His eyes were wet. You talk like somebody who knows. She didn't answer that. She just reached down and straightened his blanket and said, You're going to do fine today. I promise. You promise? Yes, sir, I promise. He nodded and closed his eyes, and by the time they reached the holding bay, his breathing had slowed and his hand was no longer gripping the rail. The surgical nurse who took him from her glanced at Avery and said, What did you say to him? He was a wreck when he came out of pre-op. Nothing special. Huh. The surgical nurse looked at her a beat longer. Well, whatever you said, thanks. Avery walked back up to the ER. Melissa was waiting for her. Where were you? Transport to surgical holding, Mr. Alvarez. I didn't ask you to do transport. Nurse Daniels asked. I am the charge nurse on this floor, not Nurse Daniels. If anybody asks you to do anything, you check with me first. Are we clear? Yes. Yes what? Avery paused, just for a fraction of a second. Then yes, Melissa. Melissa stared at her. She'd been expecting a fight or tears or at the very least a little fluster. She got nothing, just those steady gray eyes and that quiet, even voice. It bothered her a lot. Go clean out Bay 4, she said finally. Somebody threw up in there an hour ago. Yes. Avery turned and walked away. Melissa watched her go. And for the first time all morning, something very small and very uncomfortable moved in the back of her mind. She couldn't name it. She didn't want to. So she shoved it down and went back to her clipboard. By 10 in the morning, the story of the new nurse was all over the ER. The quiet one. The folder. The one who didn't flinch when Melissa chewed her out. Somebody had started calling her the ghost because she moved so quietly down the halls that you'd turn around and she'd be right behind you holding the thing you were about to ask for. It's creepy, Brittany said in the break room to anybody who'd listen. She was in the med room when I walked in, and I swear to God I didn't hear the door. Maybe you should pay attention, said Dr. Rick Patel, an attending physician who was pouring coffee and trying not to laugh. I pay plenty of attention, Rick. Uh-huh. Don't me. He raised his hand, smiling. All I'm saying is maybe the new girl isn't the problem. Brittany rolled her eyes and walked out. Dr. Patel alone now stirred his coffee and stared at the door she'd left through. He was a good doctor. He'd been a good doctor for 22 years. And in 22 years, he had learned to pay attention to the quiet ones. The loud ones told you everything about themselves in the first 5 minutes. The quiet ones you had to watch. Because when something went wrong, the loud ones usually froze and the quiet ones usually moved. He took his coffee and went back out onto the floor, and he watched Avery Knox a little more carefully from then on. At around 11, Avery was wiping down a stretcher in Bay 2 when a man came in holding his hand wrapped in a bloody dish towel. He was maybe 60, gray beard, a trucker's cap, and he was trying very hard not to look scared. I cut it on a bandsaw, he said to nobody in particular. I think I cut it pretty bad. The triage nurse, a woman named Karen, was on the phone and waved him toward a chair. Avery set down her rag. Sir, over here, please. He turned. You a nurse? Yes, sir. Can I see the hand? They said to wait. You can wait sitting down with pressure on it, or you can wait bleeding on their floor. Your choice. He almost laughed. Fair enough. She sat him down. She unwrapped the towel just enough to see deep laceration across the meat of the palm, arterial but not catastrophic. She folded the towel tighter, pressed her hand over his, and lifted the whole thing above his heart. She did it all in about 4 seconds without ever seeming to hurry. Keep it up there. Don't drop it. Breathe in through your nose for 4, out through your mouth for 6. Why? Because if you pass out, I have to pick you up off the floor, and I don't feel like picking anybody up today. He laughed for real that time. His color was already coming back. Karen hung up the phone, saw what was happening, and started toward them, half annoyed. Ma'am, I had him on the... He was about to drop, Avery said calmly. I just stabilized him. He's all yours. Karen looked at the man. The man was breathing, smiling, elevated. Karen looked back at Avery. Okay, she said, slowly. Thanks. Sure. Avery went back to her stretcher. She picked up her rag. She wiped it down. Karen walked past a minute later and said under her breath, "Where'd you say you came from again?" "I didn't." "Right." Karen didn't push it, but she also didn't forget it. At 12:30, Melissa cornered her in the supply room. "I heard you did a triage intervention on a walk-in." "I applied pressure and elevated. I didn't triage." Semantics. It isn't actually. Melissa stepped out closer. She was a tall woman and she used her height. "Let me tell you something, sweetheart. I have been in this ER for 15 years. I have seen 100 of you come through that door. Bright-eyed, quiet, thinking you know things, and every single one of them learned the same lesson, which is that there is a chain of command on my floor, and you are at the bottom of it, and when I tell you to fold linens, you fold linens. You don't touch patients. You don't talk to patients. You don't breathe on patients unless I say so. Do you understand me?" Avery didn't answer right away. She looked at Melissa, really looked at her. And in that moment, something passed across her face that Melissa did not recognize and did not like. It wasn't anger. It wasn't fear. It was something older and more tired than either of those things. It was the look of a person who had stood in front of a lot of angry people in a lot of worse places and had learned a long time ago that most of them were really just scared of something they couldn't name. "Yes, Melissa," Avery said softly. "I understand you." Melissa opened her mouth to say something else, and then for a reason she couldn't explain, she didn't. She walked out. Avery stood in the supply room by herself for a long moment. She closed her eyes. She took one slow breath in. She let it out. And then she went back to work. In the women's locker room at her lunch break, Avery sat on the bench in front of her locker and pulled her phone out of her bag. She didn't open it. She just held it. There was a photograph taped inside her locker door. It was small and it was worn at the edges, and it had been taped and retaped so many times that the corners were layered in old Scotch tape. In the photograph, 4 people in desert fatigue stood with their arms around each other in front of a Humvee. 3 men and 1 woman. The woman was Avery, 6 or 7 years younger, sunburned, smiling in a way she didn't smile anymore. She looked at the photograph for a long time. Then she whispered so quietly you almost couldn't hear it. "I'm okay, boys. I'm okay today." She closed the locker. She stood up. She went back out onto the floor. At 1:45 in the afternoon, the overhead speaker crackled. "Code Blue Room 312, Code Blue Room 312. Everything changed. Nurses started moving. A crash cart rattled down the hall. A resident, young, maybe 28, came flying out of the doctor's lounge with his stethoscope around his neck and his face already pale. Dr. Patel was in surgery. Dr. Kim was on a break. The attending on the floor was Dr. Reyes, and Dr. Reyes was brand new, 6 months out of residency, and this was his first Code Blue as the lead physician. He was about to learn what that felt like. Melissa was the charge nurse. She grabbed her clipboard and ran. Brittany ran after her. Karen ran after her. 2 techs ran after them, and Avery, who was standing in the hallway with a stack of folded gowns in her arms, watched them go. She set the gowns down on a chair. She followed. She did not run. She walked. But she walked fast, and her shoes still made almost no sound. Room 312 was a mess. The patient was a 54-year-old man named Harold Weaver. He had come in that morning with chest pain, been admitted for observation, and had looked fine at rounds. Now he was not fine. Now he was gray and silent, and the monitor above his bed was showing a flat line with a high, thin wail. Dr. Reyes was at the head of the bed. He was not moving. He was looking at the monitor. He was looking at the patient. He was looking at the monitor again. His hands were hovering in the air about 6 inches above Harold Weaver's chest, and they were shaking. Melissa was on the opposite side yelling for the crash cart. Brittany was fumbling with the paddles. Karen was trying to get a line in and missing. Nobody was doing compressions. Nobody. For 3 seconds, 3 entire seconds, which in a Code Blue is a lifetime, the room stood still. And then a voice from the doorway said perfectly, even perfectly, calm, "I've got compressions." Everybody turned. Avery was already moving. She crossed the room in 4 steps. She didn't ask permission. She didn't announce herself. She climbed up onto the step stool at the side of the bed, locked her elbows, stacked her hands over the lower third of Mr. Weaver's sternum, and started pushing. 1, 2, 3, 4. The rhythm was perfect. You could have set a metronome by it. 110 beats per minute, 2 inches of compression, full recoil between each one. Her arms were straight, her shoulders were directly over her wrists. She wasn't using her back. She was using gravity. She could keep doing this for 30 minutes if she had to, and she looked like she knew she could. Melissa stared. Brittany stared. Dr. Reyes, Dr. Reyes, whose hands were still hovering above the chest, stared too. Doctor, Avery said, not looking up, still pushing, I need you to call the code. I need Epi 1 milligram IV, push every 3 to 5 minutes. I need the paddles charged to 200. I need somebody bagging at the head. I can keep this going, but I cannot do all of it. Dr. Reyes blinked. Doctor. Her voice was a little sharper now, still calm, still level, but sharper. I need you with me, right now, call the code. He snapped out of it. Epi 1 milligram IV push, bag him, charge the paddles to 200. Thank you, doctor. Melissa found her voice. Who the hell told you to? Melissa, Avery said, still not looking up, still pushing. I will happily have this conversation with you later. Right now, I need you to get a line in his left antecubital because Karen is missing the right one and he does not have time for us to keep missing. Karen, to her credit, didn't argue. She stepped back. Melissa stepped in. Within 20 seconds, there was a line, and within 40 seconds, there was epinephrine in it, and within a minute, the paddles were charged. Clear, Dr. Reyes said. Avery lifted her hands. The shock went through Harold Weaver. The line on the monitor jumped, and then slowly, unevenly, like somebody trying to remember how to do something they used to know, it started to beep. A rhythm, shaky but real. We have a pulse, Karen said. Nobody in the room spoke for a second. Avery climbed down off the step stool. She wiped her hands on the front of her scrubs. She took one breath in and one breath out, the way you breathe when you're coming back from somewhere you had to go to survive. Then she looked at Dr. Reyes. Nice work, doctor, she said quietly. He opened his mouth, closed it, opened it again. I didn't, he started. You called it, she said. You called the code. That's what mattered. She looked at him steadily. Next time it'll be faster. They always are. He nodded. He was going to remember her for the rest of his life. Avery turned to go, and Melissa. Melissa, who had been watching all of this clipboard frozen in her hand, face the color of wet paper, stepped forward and said in a voice that came out a lot shakier than she meant it to Knox, a word, outside now. Avery paused at the door. She didn't look back. Yes, Melissa. She walked out into the hallway. And somewhere very far away, farther than any of them knew, a radio was crackling on the deck of a Navy vessel, and a man in a flight suit was leaning over a map of the eastern seaboard, running his finger down a list of names and stopping on one. Knox Avery J., former HM-1 United States Navy, Special Warfare, Combat Medic. Get me a bird in the air, he said. We've got 90 minutes. The hallway outside room 312 was narrower than it looked. Melissa was already pacing her clipboard tucked under her arm, her jaw working like she was chewing on something she couldn't spit out. Avery stood against the wall with her hands loose at her sides and waited. Do you have any idea, Melissa said, what you just did? I did compressions on a patient who didn't have a pulse. You took over a code. I started compressions while the doctor was deciding what to do. There's a difference. There is no difference. Melissa's voice cracked up an octave. You are a linen aide. You are not ACLS certified on this floor. You are not credentialed for code response. You are not, I'm ACLS certified, Melissa. Excuse me. I'm ACLS certified. I'm also PALS certified, TNCC certified, and I hold an active unrestricted RN license in 3 states. It's in my file. You signed the onboarding paperwork. Melissa stared at her. Then why the hell are you folding linens? Because that's what you told me to do. The answer landed like a slap, and Melissa felt it. She felt it in her chest, her mouth opened, her mouth closed. She took half a step back before she realized she'd done it. Down the hall, a door opened. Dr. Patel came out of the doctor's lounge with his reading glasses pushed up on his forehead, and he stopped when he saw the two of them standing there. Everything okay, ladies? Fine, Melissa said quickly. Fine, Avery said. Dr. Patel looked from one to the other. He had been a doctor a long time. He knew what fine looked like, and this wasn't it. Weaver's stable? He's stable, Avery said. Rhythm came back on the 2nd cycle. Dr. Reyes ran the code. Did he? Dr. Patel's eyes moved to her face and stayed there for half a second longer than they needed to. Good for him, he walked on. Melissa waited until he'd rounded the corner. You don't ever embarrass me on my floor again. Do you hear me? I didn't embarrass you. You, Melissa. Avery's voice was very soft now, softer than before. It had that quality that certain voices have, the kind of voice that makes a room go still without anyone knowing why. The patient was coding, nobody was compressing. I did compressions. If you'd like to write me up for it, write me up. If you'd like to fire me for it, fire me. But don't stand here in a hallway 12 feet from a man whose heart just restarted and tell me I should have let him die so you didn't have to feel uncomfortable. For a long moment, Melissa didn't breathe. Then she said very quietly, get back to work. Avery nodded once. She walked back down the hall toward the nurse's station, and Melissa stood there in the empty corridor by herself and pressed the flat of her palm against the wall because her legs, for a reason she didn't want to examine, had gone a little weak. At the nurse's station, Brittany was already on her phone. Oh my God, she was whispering, half laughing, half something else. You should have seen it. The linen girl just ran the code. No, I'm serious, Tara. She climbed up on the stool like she'd done it 1,000 times. Reyes was useless. Melissa was useless. It was her. Avery walked past the counter. Brittany's eyes followed her the whole way. Gotta go, Brittany said and hung up. Need something? Avery asked without turning around. No. Okay, Avery kept walking. She made it halfway down the hall before the overhead speaker clicked on again. Avery Knox to administration. Avery Knox to administration, please. Brittany looked up sharply. Karen looked up from her chart. Even the unit secretary, who never looked up from anything, looked up. Melissa, coming around the corner, heard it and stopped dead. Administration, she said. On day one, Avery didn't answer. She just changed direction and walked toward the elevators. Her heart, if anybody could have heard it, was beating exactly the way it had been beating 10 minutes earlier during the code. Not fast, not slow, steady. The same way it had beaten in a Humvee outside Ramadi in 2014 when the IED went off and 3 of her friends stopped being alive. The same way it had beaten in the back of a medevac bird over the Hindu Kush with somebody else's blood up to her elbows. The same way it had beaten the morning she walked into the VA and told a man with a soft voice that she was done, that she couldn't do it anymore, that she needed to go be a regular person for a while. Her heart had one rhythm for hard things. It had learned that rhythm a long time ago. It didn't know any other. The elevator doors opened. She stepped in. The doors closed. And 4 floors up in a corner office with a view of the parking lot, the hospital's chief executive officer, a man named Gerald Hoffman, 61 years old, former hospital attorney, 3-piece suit, even on Saturdays was standing behind his desk with a phone pressed against his ear, listening to a voice he did not recognize say something he could not quite believe. I'm sorry, Hoffman said. Who did you say this was? Captain James Holloway, United States Navy. I'm calling from Naval Special Warfare Group 2 in Virginia Beach. I need to speak with a member of your nursing staff. Her name is Avery Knox. Captain, Sir, I don't have time to explain this twice. I have a bird in the air. I have a sailor on that bird who is going to die in the next 90 minutes if certain things don't happen. Avery Knox is the nearest qualified individual on our list, and your facility is the nearest level 1 trauma center. We are inbound. I am notifying you as a courtesy. You will have her on the roof when we land, or I will come find her myself. Captain Holloway, sir, I don't even know that we have a nurse by that. Check your payroll, sir. She started this morning. Hoffman blinked at his computer. His fingers were clumsy on the keyboard. He typed the name. He hit enter. The file came up. He read it. He read it again. He sat down. Oh my God, he said softly. Sir, she's here. He was still reading. Captain, this file says she's a registered nurse, community clinic background. That's her cover employment. I'm telling you what the Navy's file says. Which is what? There was a pause on the other end of the line. Then Holloway said carefully, which is classified. But for the next 90 minutes, sir, I am unclassifying enough of it to save a man's life. Hospital man First Class Avery Knox served 6 years in Naval Special Warfare as an embedded combat medic. She held a billet almost no woman in the history of this branch has held. She has surgical field experience on 3 continents. She has personally kept alive men who should not have been kept alive. One of those men is my son. Hoffman's mouth was dry. Your son is on them? My son is on the bird, sir. Hoffman stood up again. He wasn't sure why he stood up. It just seemed like the kind of information you stood up for. I'll have her on the roof. Thank you. The line went dead. Hoffman stood in his office for a second, breathing. Then he grabbed his suit jacket off the back of his chair, and he moved faster than a 61-year-old CEO had moved in years. Down in the elevator, Avery was watching the floor numbers climb. She didn't know any of what had just been said in Hoffman's office. All she knew was that on her first morning on a new job, 3 hours into her first shift, she had been called to administration. And in her experience, when administration called you on your first day, it was not to say thank you. She had already made peace with being fired before the elevator reached the 4th floor. She'd been fired before. She'd been fired from 2 jobs since she came home. One was a hospital in Denver that fired her because she couldn't bring herself to smile at a surgeon who'd screamed at a medical student. The other was a clinic in Montana that let her go because she had, quote, an intensity that was making some of our patients uncomfortable. She had stopped taking it personally, mostly. The doors opened on 4. A woman in a pencil skirt was already waiting for her. Nurse Knox, Mr. Hoffman needs you in his office immediately. Okay. Right now, please. Okay, Avery said again and followed. Hoffman met her at the door. He didn't sit. He didn't offer her a seat. He just looked at her, really looked at her the way people look at a person when they have just learned 90 seconds ago that the person they hired to fold linens is not in any meaningful sense the person they hired. Ms. Knox. Sir, I just received a phone call. Yes, sir. From the United States Navy. Avery's face changed, just a little, just around the eyes. Hoffman saw it and filed it away. Sir, she said carefully, what did they want? They want you, on the roof, in roughly, he glanced at his watch, 64 minutes. There is a helicopter inbound with a critically wounded sailor. The officer on the line said your name specifically. He said you were the nearest qualified medic. He said, Hoffman paused. He was a man who chose words for a living, and he was choosing this one. He said his son is on that helicopter. Avery didn't move. She didn't move for so long that Hoffman almost said her name again. And then very softly she said a single word. Holloway. Hoffman stared at her. I'm sorry. Captain Holloway. She wasn't looking at him. She was looking somewhere past his shoulder, somewhere about 1,500 miles away. His son's name is Danny. Daniel Holloway. He was a kid when I knew him. He was 19. Miss Knox. He had a laugh like... She stopped. She closed her eyes for half a second. When she opened them again, she was back in the room. What's the ETA? 64 minutes, maybe less. What's the injury? I wasn't told. Call him back. Tell him I need to know what I'm walking into. GSW shrapnel burns blast. I need to know. I need blood on standby. I need O-6 units minimum. I need a trauma bay prepped and an OR on hot standby. I need your best trauma surgeon paged now, not when the bird lands. I need Dr. Patel. Dr. Patel is in. Get him out. Hoffman stared at her. And then because he was smarter than he looked, he picked up his phone and he did exactly what she said. While he dialed, Avery turned and walked to the window. She pressed her hand flat against the glass. Outside, the sky was a pale, cold blue. Somewhere out there, maybe already over the coast, was a helicopter with Danny Holloway on it. A boy who had once given her half of a Hershey bar in the back of a transport truck and told her that when he got out of the Navy, he was going to open a bakery because his grandma had made the best cinnamon rolls in Alabama, and he was going to learn to make them too. She had not thought about that Hershey bar in 6 years. Her hand on the glass shook. Just once. She pulled it back and pressed it flat to her thigh, and the shake stopped. Behind her, Hoffman was saying, yes, sir. Yes, sir, I understand. He hung up. Blast injury, he said. IED, lower extremity, massive hemorrhage. They've got a tourniquet on, but it's been on almost 40 minutes. Which leg? Right. Above or below the knee? Above. Her jaw tightened. Okay. Ms. Knox. Call the OR. Tell them I want a vascular surgeon scrubbed in the moment we land. Tell them if they don't have one in the building, they'd better find one who can drive here in an hour. Tell them I want a rapid infuser in the bay, the level 1, not the Belmont, and I want it warmed and primed before we touch that roof. Tell them to open the fridge. I want oneg hanging. I want plasma thawed. I want platelets on the way from the blood bank. She turned, and somebody needs to tell Melissa Harper that I'm leaving the ER floor. Because if I just disappear off her floor without permission, she is going to lose her mind. Hoffman almost laughed. It came out as more of a breath. I'll tell her myself. Thank you, sir. She moved toward the door. Ms. Knox. She stopped. She didn't turn. Why didn't you put any of this on your application? For a long moment, she didn't answer. When she did, her voice was quieter than it had been all day. Because, sir, I came here to stop being that person. I came here to fold linens and walk old men to surgical holding and tell them they were going to be fine. I came here to be quiet. I came here to be done. And now, she put her hand on the doorknob. She looked back over her shoulder, and for the first time since she had walked into St. Gabriel Medical Center that morning, Gerald Hoffman saw the other Avery Knox, the one in the photograph inside the locker, the one with the sunburn and the smile look out from behind the quiet one's eyes. And now I'm going to the roof, she said, because Danny Holloway is 19 and he eats Hershey bars and he wants to open a bakery, and I'll be damned if he dies on my floor. She opened the door. She walked out. Hoffman stood alone in his office. He sat down in his chair. He picked up his phone again, and this time when he dialed, his hand was not quite steady. Down on the ER floor, Melissa was in the middle of chewing out a tech about restocking procedures when the charge phone rang. She grabbed it with her free hand. Harper? R. She listened. The tech watching her would later say that he saw the color leave her face in 3 distinct stages, like a dimmer switch being turned down, and that in 15 years of working under Melissa Harper, he had never not once seen her look afraid. I'm sorry, she said. Who? She listened. Say that again, please. She listened. Yes, sir. Yes, sir. Right away. Yes, sir. She set the phone down. She stared at it. Brittany from across the counter. Melissa, you okay? Melissa didn't answer. Karen walking up. Hey, you good? Melissa looked at both of them. Then she looked past them down the long hall toward the elevators, where a quiet woman in plain navy scrubs had disappeared 5 minutes ago after being called upstairs. Oh my God, Melissa whispered. What? Oh my God. Melissa, what? She's a SEAL. Brittany laughed. What? She's a SEAL, the linen girl, Knox. She's... Melissa's hand went up to her own mouth like she was physically trying to hold the words in. There's a Navy helicopter inbound. They're asking for her by name. Hoffman just called. There's a soldier on it, and Karen's coffee cup stopped halfway to her lips. Brittany's face, which had been smirking half a second earlier, went completely flat. No, Brittany said. Yes. No, Melissa, you're messing with me. I am not messing with you. And then because the universe has a sense of timing that no screenwriter could improve on the overhead, speaker crackled to life one more time. Attention all staff. Attention all sourced all staff. Incoming rooftop arrival military medevac, ET. A 48 minutes. Trauma Team 1 report to the roof helipad. Trauma Team 1 to the roof helipad. Nurse Avery Knox to lead. The ER went silent. Not quiet. Silent. You could hear the IV pumps beeping. You could hear somebody's phone vibrating on a counter. You could hear from somewhere way down the hall the patient laughing at a television. Brittany set her coffee down so carefully it didn't make a sound. Karen whispered, "Oh my God, oh my God." Melissa's clipboard slid out from under her arm and hit the floor. She didn't pick it up. Down the corridor, the elevator dinged. The doors opened. Avery Knox stepped out. She had pulled her hair back. She had tied it tight. She had taken off the plain scrub top she'd worn that morning, and she was wearing a sterile gown now pulled on over a trauma vest, and she was moving down the hallway at a walk that somehow looked like a run. She didn't look at Melissa. She didn't look at Brittany. She didn't look at Karen. She walked past all of them like they weren't there, and her shoes, for the first time all day, were not silent on the floor. Her shoes were making a sound now, a steady, hard, measured sound, and every person who heard it turned to look at her. Dr. Patel was coming out of trauma bay, pulling on gloves, his surgical cap already tied. He fell into step beside her without a word. "Tell me," he said. "Blast injury, right leg above the knee, tourniquet on 40 minutes. Hemorrhagic shock, probably class 3 by now, maybe class 4. 20-year-old male, 19. You know him. I know him. Okay, Dr. Patel said simply. What do you need me to do? She told him, walking fast in clean, short sentences, exactly what she needed him to do. At the end of the hall was a door. On the door was a sign that said rooftop access authorized personnel only. Avery Knox put her hand on the door. She paused. Behind her, way down the hall, she could feel 43 pairs of eyes on her back. She didn't turn around. She pushed through the door, and the sound of the wind, and the sound of something far off and mechanical, and the sound of her own heart all came up to meet her at once. The wind hit her in the chest before the door had even fully opened, and she leaned into it the way a person leans into an old memory they don't want to have but can't put down. Dr. Patel came through behind her. So did two trauma techs with a stretcher. So did a respiratory therapist named Luis, who had been at St. Gabriel for 11 years and had never not once been called up to the roof for anything. How far out? Patel shouted. Avery tapped her earpiece. She had clipped it on in the elevator. Somebody in the command office had given her a comms channel. Command, this is Knox on the pad. Give me a time. A voice crackled back. Knox, this is Holloway. You're 6 minutes out. 6 minutes. Copy 6 minutes. Knox. Go. He's losing pressure. Our corpsman is bagging him. Systolic dropped to 70 over the last 4 minutes. Avery closed her eyes for half a second. Holloway, tell your corpsman to push another unit of whole blood if he's got it. If he doesn't push saline, but only enough to keep him perfusing. Don't flood him. We'll replace volume on the ground. Copy. And Holloway. Go. Tell Danny, tell him Knox is on the roof. A pause. Then from the other end of the channel, in a voice that for one instant was not a captain's voice but a father's, he knows Knox. He knew before we called you. He said your name. Her jaw set. She didn't answer. She just tapped the earpiece twice and moved. Behind her, Patel was staring. Knox. Yeah. You were a SEAL. I was attached to a SEAL team. There's a difference. Is there? Not really. She was checking the kit they'd brought up. She was pulling out a field tourniquet, a combat gauze roll, a chest seal, a decompression needle, 2 units of ONEG in a cooler pack. Her hands moved without her having to tell them where to go. Her hands had done this 1,000 times. Patel. Yeah. When they come off that bird, I do not want a conversation. I do not want hospital protocol. I want to run this the way I know how to run it. And the minute we hit the trauma bay downstairs, it's yours. But up here, it's mine. Okay. Dr. Patel, who had been an attending physician for 22 years, who had trained at Johns Hopkins, who had 3 daughters and a Tesla, and a reputation for not letting anybody tell him how to practice medicine in his own hospital, Dr. Patel looked at this woman he had met 4 hours ago, and he said without a flicker of ego, "It's yours. Thank you." The door behind them banged open again. Hoffman came through, tie-flapping suit jacket still unbuttoned. Behind him, to Avery's absolute astonishment, was Melissa. "What is she doing up here?" Avery said flatly. "I asked her to come." "Sir Knox." Hoffman stepped closer so the wind wouldn't take his words. "She is my most experienced charge nurse. If you need hands, you need hers. I know where the 2 of you stand. I don't care. You need her." Avery looked at Melissa. Melissa looked back. For the first time all day, Melissa Harper's face did not have a single hard line in it. It was just the face of a middle-aged woman standing on a hospital roof with the wind pulling at her hair, wearing a charge nurse's badge she had earned over 15 years of showing up, and she was waiting, actually waiting to be told what to do. "Melissa?" "Yes, Knox." "I need you on the blood cooler. When I call for a unit, you hand it to me. I do not want to look for it. I do not want to ask twice. You stand on my left, you keep that cooler open, you hand me what I ask for in the order I ask for it. Can you do that?" "Yes." "Say it again." Melissa swallowed. "Yes, Knox." "Okay, thank you." Somewhere in the sky north of them, a thin vibration started in the air. It wasn't loud yet, but Avery felt it in her sternum before she heard it, and her head came up. 4 minutes. She said not to anyone in particular. They're 4 minutes out. She turned to the trauma techs. "When that bird touches down, do not run. I know you want to. Don't. You wait until the corpsman gives you the clear hand. Then you come in from the 9 o'clock side-low stretcher on the deck. You do not lift him, you slide him. You hear me? Slide. If you lift and that leg moves, he bleeds out in 90 seconds. Yes, ma'am. Don't call me ma'am, call me Knox. Yes, Knox. She turned back to Patel. Her earpiece crackled again. Knox Holloway, pressure's dropping, 64/30. Copy. Knox. Go. He's losing consciousness. She closed her eyes. She opened them. Holloway, put the radio up to his ear. A pause. Say again, I. Put the radio up to his ear. There was a rustling sound, then far away, impossibly far, a young man's voice. Thin, rattling, half there. Knox, her throat closed. She swallowed it. Danny, hey, it's me. Knox. Listen to me, buddy. You are going to land on this roof in about 3 minutes and 15 seconds. And I am going to be standing right here when you do. And I am going to fix you, Danny. Do you hear me? I am going to fix you. Just like Ramadi. Just like Kandahar. You remember, right? Hurts. I know it does, baby. I know it does. You just stay with me. You stay with your daddy's voice, and you stay with mine. You think about that bakery. You think about those cinnamon rolls. You think about your grandma. You stay right there, Danny. You stay with me. You hear. A breath, thready, far. Yes, ma'am. Good boy, good boy. 3 minutes, Danny. 3 minutes. The radio went quiet. Avery lowered her hand from her ear. She stared straight ahead at the sky, and Melissa, standing 3 feet to her left with the cooler open, saw the tear track down the side of Avery Knox's face. And she saw Avery Knox not wipe it away because there wasn't time, and because Melissa understood in that moment, with absolute clarity, this woman had learned a long time ago not to waste motion on her own face when there was work to do with her hands. Melissa, who had been awake since 4 a.m., who had chewed this woman out twice that morning over linens, felt something crack open inside her chest that she was not going to be able to close again. Knox, she said very quietly. Yeah, I'm so sorry. Not now, Melissa. Okay. Later. Okay. The vibration in the air had become a sound. The sound had become a thump. The thump had become the rotor wash of a Sikorsky coming hard and low out of the north, and every piece of loose fabric on that rooftop started to whip. Hold the line, Avery said more to herself than to anyone. Hold the line. The bird flared. The skids kissed the deck. The side door slid open before the rotors had even begun to slow. A young corpsman jumped out first. He was bloody to his elbows. His face was the color of paper. He saw Avery, and the word came out of him like a sob. Knox, I got him, come on. What happened next happened in a blur that later, when the security footage was reviewed, would be played back in slow motion by every news station in the country. But on the rooftop in the live air, it was just a rhythm. It was a series of movements so clean and so fast that the people watching it would later say it looked like a dance. Avery was at the door of the bird before the cordman had both feet on the deck. She was up the step in one motion. She was inside. She was on one knee beside a stretcher where a 20-year-old boy named Daniel Holloway was lying the color of old wax with a cat tourniquet above his right knee and a field dressing that was soaked black. She put 2 fingers on his neck. She got a pulse, barely. Danny, open your eyes, buddy. His eyes opened a 1/4 of an inch. There you go, there you are. Okay, we're moving. She was already cutting the dressing. She was already barking orders over her shoulder. Patel, I need you in here. I need a second line. I need the oneg spiking now. Melissa, Unit 1, give it to him. No to me. Patel, catch. Yes, that one. Luis on his airway. He is hypoxic. I need him at 6 liters. Non-rebreather. Go, go. Inside the helicopter, it took her 4 seconds to see what she was dealing with. It was worse than she had been told. The tourniquet was holding, but the wound above it had a secondary bleeder, a vessel that had been nicked when they'd bounced him onto the bird, and every time his heart beat a little more of him was leaving. Damn it, she whispered. Damn it, damn it, damn it. What? Patel beside her mouth, his gloves already red. Secondary bleed. I need hemostatic. I need... She was pulling packets out of her kit with her teeth, ripping them open with her teeth because her hands were occupied. I'm going to pack it. Patel, when I say you release the tourniquet for 3 seconds, 3 seconds only, I need to see where the bleeder is. Knox, if you release that, I know what happens if I release it. 3 seconds. On my count, hold pressure above. Go. He went. She counted. 3, 2, 1, release. Patel released. Blood came up out of the wound in a way that was not a trickle and was not a stream. It was a pulse, a steady, bright, arterial pulse, and Avery Knox saw it, and her hand went into the wound up to her wrist, and she found the vessel by feel, the way she had found vessels by feel in the back of a truck in Anbar Province, and she pinched it between her thumb and forefinger. Clamp. Patel slapped a clamp into her open palm. She walked the clamp down her own fingers. She closed it. The pulse stopped. Tourniquet back on. Patel tightened it. The bleeding slowed. It didn't stop, but it slowed. Okay, she breathed. Okay, let's move him. Slide, boys, slide. The two trauma techs came up on either side. The corpsman, the young one, moved to Danny's head, and he did not let go of the boy's hand for 1 second. The stretcher went from the helicopter to the pen in one smooth motion. Avery was walking beside it with her hand still inside the wound, holding the clamp, holding the vessel, holding Danny Holloway's life between her thumb and her index finger. Elevator, she said. Now. They moved. Inside the rooftop access down the corridor, the ER staff had gathered by the elevator bank. They had gathered the way people gather at the edge of something they know they are about to watch and never forget. Brittany was there. Karen was there. Dr. Reyes was there. Even the receptionist with the beaded glasses chain had come up from the lobby because the word had spread through the hospital the way word spreads through a hospital, which is faster than any PA system ever invented. They saw the stretcher come through the door. They saw Avery Knox walking beside it. They saw her arm up to the elbow in a young man's leg. They saw her other hand holding the rail of the stretcher, and they saw her eyes, and nobody, not one person, said a word. She did not look at them. She said to the room generally, move. They moved. The elevator doors opened. The stretcher rolled in. Patel, Melissa Louise, the two techs, the corpsman Avery. The doors started to close. Hoffman from the hallway. Trauma Bay 3 is open, or 2 is scrubbing in. Avery nodded once. The doors closed. Inside the elevator, Danny Holloway's eyes drifted open again. They tried to focus on her face. They almost did. Knox. I'm here, buddy. Am I? You're at St. Gabriel. You're in a hospital. We're going downstairs to fix you up. Hurts. I know. My dad. Your dad is on the radio. He knows where you are. He's proud of you, Danny. You hear me? He is so damn proud of you. Tell him, don't you dare. You tell him yourself. You tell him yourself in an hour. Danny, you hear me? Don't you put that on me. His hand moved. It fumbled. It found the hem of her gown. It held on. The elevator descended. Nobody in that elevator said anything for the longest 7 seconds of any of their lives. The doors opened on the ground floor. And at the far end of the hallway, standing in the open doors of Trauma Bay, 3 Dr. Patel's entire team was waiting. Surgical caps on, gloves on, rapid infuser primed, blood hanging. The vascular surgeon, a woman named Dr. Yunji Park, who had been summoned from her lunch and had driven across town in 11 minutes, was already scrubbed. Knox, Dr. Park called. Talk to me. Avery talked to her. Fast, clean, every word in the right order. Clamp position, blood loss estimate, last pressure, last pulse, hemostatic agents used, time on tourniquet, time on secondary clamp, the names of 2 medications that had been administered on the bird that were not standard hospital pharmacy, but that Dr. Park understood instantly because she had done her residency near Fort Belvoir, and she knew what combat pharmacology looked like. Copy, Park said. I have him. He's yours. Knox, he's yours. Park, go. Avery took her hand out of the wound. Dr. Park's hand went in. The clamp transferred. Park's gloved fingers found the seat of the bleed without Avery having to guide her because Park was that good and Avery had set it up that way. Danny Holloway disappeared into Trauma Bay 3. Avery Knox stood in the hallway outside with a gown soaked to the waist in a boy's blood, and her hands for the first time all day were shaking. Melissa was behind her. Patel was behind her. Luis was behind her. The 2 trauma techs were behind her. The young corpsman from the helicopter was behind her, and he was crying silently into the back of his own hand because he was 19 years old too, and this had been his first bird. Avery did not turn around. She walked a few steps away from them. She put her back against the wall. She slid down it until she was sitting on the floor. She put her forearms on her knees. She lowered her head. And from somewhere far, far inside her, from a place she had not opened in 6 years, a sound came out of her that was not quite a swim and not quite a breath. It was the sound a person makes when they have just carried something across a river and set it down on the other side and realized only then how heavy it had been. Melissa took one step forward. Patel put a hand on Melissa's arm. He shook his head once. Melissa stopped. They stood there, all of them, in the hallway, and they did not say anything. They let Avery Knox sit on the floor with her head down and her hands shaking, and they let her do it alone because they understood, all of them. Even Melissa, even Brittany, who had come down from upstairs and was standing 10 feet away with her hand over her mouth, that what she had just done was not a thing you cheered for. It was not a thing you clapped for. It was not a thing you congratulated somebody for in a hospital hallway. It was a thing you let them have their moment with. A phone rang. It was Hoffman's. He had come down in the other elevator. He answered it. He listened. He said, "Yes, sir. She's right here, sir. Yes, sir. Hold on." He walked over to where Avery was sitting. He held out the phone. Avery looked up. Her eyes were red, but they were dry. "Who is it?" she said. "Captain Holloway." She took the phone. She pressed it to her ear. She did not stand up. "This is Knox." On the other end of the line, James Holloway, a man who had commanded men in 4 countries, who had buried 11 of his brothers over the course of his career, who had not cried in public since 1998, was not speaking. He was just breathing. His breath came through the phone. "Captain," she said. "Knox." His voice broke on the one syllable. "Knox, they told me he made it to the table. He made it to the table." "Knox. He's in surgery. Dr. Park has him. She's the best vascular surgeon in this hospital. He's in the right hands." A long, long pause. "Knox." "Yes, sir." "I never had a way to thank you. For 2014, for Hamid, for the 3 of them. I never had a way." She closed her eyes. "Captain, now I do." The line held. She couldn't speak. She couldn't say anything. She just sat on the floor of St. Gabriel Medical Center in a stranger's hospital. 740 miles from the base she had once called home, holding a CEO's phone against her ear, listening to an older man on the other end of the country, not being able to get the words out. "You saved my boy Knox." "Not yet, sir. Park has to save him now." "You kept him alive long enough. You kept him alive long enough for her to try." "Yes, sir." "That's enough. That's enough, Knox. That's enough." She nodded even though he couldn't see her. "Captain?" "Yes." "Call me when he wakes up." "I will." She handed the phone back to Hoffman. She put her head back down on her knees. Above her, somebody was crying quietly. It was Melissa. She was standing against the opposite wall with her fist pressed against her mouth, and her shoulders were shaking. And Karen, who had worked next to Melissa Harper for 11 years and had never once seen her cry, was holding her by the elbow without saying a word. In the waiting area at the far end of the hall, a janitor had stopped mopping. He was watching. He had his phone out. Without anyone noticing, without any malice, without any intention beyond the human one of wanting to tell his wife about what he had just seen, he had been filming for the last 4 minutes. The video was already uploading. By the time Dr. Park walked out of trauma bay 3:41 minutes later, with her mask pulled down around her neck, and gave a single tired nod to the hallway, the video had been viewed 86,000 times. By the time Avery Knox finally stood up off that floor, the number was 2 million. And somewhere in a Pentagon office, a man who had not thought about a name on a list in 6 years was watching a shaky phone video on his desktop screen, and he was picking up a phone and he was saying to somebody on the other end 3 words: "Find her, now." She did not know yet about the video. She did not know yet about the Pentagon office. All Avery Knox knew, sitting on the linoleum floor of St. Gabriel Medical Center, with her back against the wall and her hands still sticky with somebody else's blood, was that Danny Holloway was alive, and that Dr. Yunji Park had just walked out of Trauma Bay 3 and given her a nod, and that nods in her experience were the only kind of victory that ever really counted. Park crossed the hallway and crouched down in front of her. "Knox, talk to me. He's stable. We saved the leg. He's going to limp for the rest of his life, but he's going to have the leg, and he's going to have the rest of his life to limp on it." Avery pressed her palms into her eyes. Hard. She held them there for a 5 count. "Park. Yeah. Thank you." "Don't thank me." You handed him to me with a pulse. You handed him to me with a clamp already on the right vessel. You did my job for me in the back of a helicopter, Knox. I don't know where the hell you came from, but I'm honored. Dr. Park's voice cracked. She was not a woman who cracked. I'm honored to have been in the room. Park. No, don't. Take it. Just once. Take it. Avery, who had never in her life been good at taking a compliment, nodded because there was nothing else to do. Park squeezed her shoulder once and stood it up. I'm going to go talk to his father. Park. Yeah. Tell him Danny was talking when we brought him in. Tell him the boy wasn't alone. I'll tell him. Park walked off down the hall. Her scrubs were soaked. Her hair was wet at the temples. She did not look back. Melissa was still standing against the opposite wall. Karen was still holding her elbow. Patel was standing with his arms folded, staring at the floor. The young corpsman from the Bird was sitting on a rolling stool somebody had brought out for him, and he was breathing the slow, deliberate breaths of a man who had been told firmly to breathe. Avery pushed herself up off the floor. She swayed for a second. Patel reached for her elbow and she waved him off. I'm fine. Knox, I'm fine, Rick. It was the first time she had called him by his first name. He noticed. He let it go. She turned and started walking down the hallway toward the locker room. She needed to change. She needed to wash. She needed to put her forehead against a cold mirror for about 90 seconds and remember which year it was. She made it 4 steps before Brittany stepped in front of her. Brittany's face was blotchy. Her eyes were wet. She had her hands pressed together in front of her chest like a person about to pray. Avery. Not now, Brittany. Please, please. I just need to say Brittany, I am asking you as a professional courtesy to let me walk to the locker room. I'm so sorry. Avery stopped. She didn't turn. She just stopped. I am so sorry. The things I said, the bet with Melissa, I know about the bet. Brittany's face went white. You heard? I hear a lot of things. People think quiet means deaf. It doesn't. Oh, God. Brittany, listen to me. I don't want your apology. Not right now. Not like this. Not because you just watched somebody on a stretcher. That's not apology. That's theater. If you still mean it in a week, come find me. We'll talk. Brittany opened her mouth, closed it, nodded. Avery walked past her. Behind her, Melissa's voice, Knox. She didn't turn. Knox, please. She stopped. She did turn this time. Melissa was walking toward her. Melissa Harper, 15 years in that ER charge, nurse drill sergeant, the woman who had once made a resident cry for handing her the wrong size glove. She was walking with her hands out slightly at her sides, palms open the way a person walks toward a dog they're not sure is going to bite. I am not going to give you a speech, Melissa said. I'm not. I'm going to say one thing and then I'm going to leave you alone until you want to talk, if you ever want to talk. Okay. I was wrong about you. Melissa, I was wrong about you in a way that I am going to be thinking about for a long time, Knox. I saw somebody quiet walk onto my floor and I decided I knew her. I didn't know her. I wasn't even close to knowing her. And the thing is, Melissa's voice caught. She pushed through it. The thing is, I've been doing this for 15 years and I should have learned by now that the ones who don't say anything are usually the ones who have the most to say. And I forgot. I forgot that today. And I'm Melissa. Yeah. Stop. Melissa stopped. Avery looked at her for a long second. Tomorrow morning at 7, Avery said quietly, I am reporting to your floor. I am going to fold linens. I am going to wheel old men to surgical holding. I am going to do what you tell me to do when you tell me to do it. And you are going to let me. Because I came here to be a nurse, Melissa, not a hero. And if you will let me just be a nurse on your floor, then we don't need to have another conversation about any of this. Are we clear? Melissa's eyes filled up. Yes. Good. Avery started walking again. She made it 3 more steps. Then she stopped one more time and without turning around, she said just loud enough for Melissa to hear, and Melissa. Yeah. Pay Brittany the $20. I wasn't in tears. She wins. Down the hall, Melissa Harper laughed. It came out broken. It came out wet. But it was a laugh, and it was the first one she had managed all day. And she was going to remember the sound of her own laughing in that hallway for the rest of her career. Avery made it to the locker room. She closed the door behind her. She leaned against it. And then finally, in a room with no witnesses, she let her legs stop holding her up. She slid down the door. She put her head in her hands. And she did not cry exactly because Avery Knox did not cry exactly, but she made a sound with her whole body that a person makes when they have been holding something up for 6 years and somebody has finally asked them to put it down. She sat on the floor of the locker room for 9 minutes. Nobody came in. When she finally stood up, when she finally stripped off the bloody gown and threw it in the biohazard bin and stepped into the shower in her bra and scrub pants, because she did not have time or patience for any more clothes to come off, she did not know that her phone in the bottom of her locker was vibrating against the metal. It had been vibrating for 20 minutes. 37 missed calls. 462 text messages. The janitor's video had 1.4 million views. Upstairs in Hoffman's office, the CEO was on his third phone call in 10 minutes. The first had been with the hospital's press officer. The second had been with the chairman of the board. The third was the one that had made him close his office door and ask his assistant to hold everybody. Sir Hoffman said, "I need to be sure I'm hearing you correctly." The voice on the other end of the line, unhurried, unbothered, carried the flat mid-Atlantic accent of a career government man. "You're hearing me correctly. The White House." "Correct." "Wants to fly her." "Wants to invite her." "Flying is her decision. The secretary would like to thank her personally. There will be a ceremony. There will frankly also be a photo op, and I won't pretend otherwise to you, Mr. Hoffman. Your hospital would be in that photo. Your hospital would also be in the statement the Department of Defense is preparing. I am calling you as a courtesy before either of those things happens." Hoffman sat down slowly. "Sir, Mr. Secretary, I don't know that Nurse Knox is going to accept." There was a pause on the other end of the line, and then in a voice that had a very small amount of something that might have been amusement in it, "Mr. Hoffman, I have known Avery Knox for a little over 7 years. You're correct. She is not going to accept. But we are going to ask her. And you, sir, are going to give her the message." "Yes, sir." "One more thing. Sir, there is a commander flying in this afternoon. His name is Ethan Ward. He was Knox's team leader for 2 of her deployments. He asked for the flight himself. He will be landing at your facility at approximately 15:30. Please have someone meet him." "Yes, sir." "And Mr. Hoffman." "Yes, sir. Whatever you were paying her, whatever you thought you were paying her to fold linens, I would reconsider your compensation structure. I'm not threatening you. I'm telling you as a man who used to run payroll for the Navy that if you lose that woman, you will not get another like her. Not in this life." The line went dead. Hoffman sat with the phone in his hand for a long moment. Then he set it down. Then he pressed the intercom. "Diane, get me the HR file on Avery Knox, and get me the head of nursing, and get me somebody from security who can clear the lobby, because in about 20 minutes there are going to be news vans." "Sir." "Just do it, Diane, please." Down in the cafeteria, an orderly named Marcus was showing his phone to a cluster of nurses. Watch this. This is our hospital. This is our ER. I've been there this morning. I was there, man. I was on the 2nd floor. Is that Knox? That's Knox. That's the new one, the quiet one. Oh my God. Her arm is that her arm in the Marcus? Play it again from the beginning." Phones were coming out all over the cafeteria. The video was on local news already. A reporter at WKRG was being handed a press release. A reporter at CNN was getting an email from a source at the Pentagon. A producer at a national morning show was calling her assistant and saying the words, "Get me this nurse." At the same moment in a high school in a small town in Alabama, a 71-year-old woman in an apron was being called to the principal's office because her grandson had just been on the news and they wanted to know if she'd like to sit down. Her name was Elma Holloway. She had raised Danny from the time he was 4. She made people said the best cinnamon rolls in the state. She walked into the principal's office. She sat down. They turned the television toward her. They played her the clip. And Elma Holloway, who had not wept since her husband's funeral in 2003, put her apron over her face and cried like a child because her baby was alive. And because a woman she had never met, a quiet woman in blue scrubs with gray in her ponytail, had carried him out of that helicopter with her hand inside his leg, and because the Lord Elma had always said, sent the right people to the right rooms at the right times, even when nobody in those rooms knew each other's names. Back at St. Gabriel, Avery was coming out of the shower. She had put on a clean set of scrubs from the spare stack. Her hair was wet. She had pulled it back into the same tight knot. She opened her locker. She saw her phone. She saw the number of notifications, and her stomach dropped the way it hadn't dropped even during the code. She didn't open the phone. She opened the text messages one at a time, one after the other, standing there at the locker, and what she saw was not what she had expected. Knox, it's Ramirez. I just saw the video. Baby girl, I am so proud of you. Avery, this is Chief Donovan. You good, call me. Knox, Ward, I'm in the air. I'll be on your roof at 3:30. Don't argue with me. Avery, it's Mama. Somebody called me from the VA. They said you saved a boy. They said it's on the news. Are you okay, baby? Please call. She closed her eyes. She stood with her forehead against the locker door for a minute. Then she opened her phone and she called her mother. Her mother picked up on the first ring. Avery? Mama. Avery, baby. I'm okay. Oh, honey. Her mother's voice was the kind of voice only mothers have, the kind of voice that holds 40 years of a daughter's life inside 2 syllables. Oh, my honey, are you okay? Are you really okay? I'm okay, Mama. You said you were done. I know. You said you were done, Avery. Avery, you told me last Christmas you were done. I know what I said, Mama. Then why? Because he was on the bird, Mama. Because it was Danny. Because it was Danny Holloway, and I couldn't. Oh, baby. Avery sat down on the bench in front of her locker. She put her elbow on her knee. She put her forehead in her hand. I didn't want to, Mama. I didn't want to be her again. I know you didn't, honey. I wanted to fold the sheets. I wanted to walk the old men. I wanted to be a regular nurse. Mama, just a regular nurse, and they were going to let me. They were going to let me be her. I almost had it. Avery Marie Knox. Yes, Mama. You listen to me. Yes, Mama. You didn't stop being who you are, baby. You just took a rest. Folding sheets was a rest. Walking old men to surgery was a rest. The Lord lets you rest, and then he called you back because that boy needed you. And you answered. And that is not a failure, Avery. That is not a relapse. That is not you losing. That is you still being who you were made to be. Do you hear me? Avery did not answer. Do you hear me, baby? Yes, Mama. Good. Now, I'm getting on a plane tomorrow. Mama, no. Avery? Mama, I'm getting on a plane tomorrow. I will see you at dinner time. I am bringing your father's quilt, and I am bringing a jar of my chicken soup, and I am bringing myself, and you are going to let me because you have been by yourself in that apartment for 6 months, and today is not a night to be by yourself. Am I clear? Avery laughed. It came out small and cracked. Yes, Mama. I love you, baby. I love you, Mama. She hung up. She sat there for a moment with the phone in her hand. And then because Avery Knox had always been the kind of person who got the worst call out of the way, first she scrolled back through her messages and she opened the one from a contact that was saved in her phone only as the letter E. Knox, Ward. I'm in the air. I'll be on your roof at 3:30. Don't argue with me. E, she stared at it. 3:30. She looked at the clock on the wall of the locker room. It was 3:18. She stood up. She tied her shoes. She took one breath in. She took one breath out. She closed her locker, and in doing so, she did not notice, because she hadn't looked at it in years, that the old photograph taped inside the door had in one of its corners the partial edge of a man's shoulder and the very tip of a sleeve, and the patch on that sleeve, if you looked hard enough, was the patch of a SEAL team leader whose name was Ethan Ward. She walked out of the locker room. She walked down the hallway. She did not take the main elevator this time. She took the back stair. She climbed it 2 steps at a time. Her legs were tired. She climbed anyway. On the 4th floor landing, she passed a window, and through the window, she saw just barely the dark shape of a second helicopter on approach from the south. She did not slow down. She pushed through the rooftop door. The wind hit her the same as before. She walked to the center of the helipad. She folded her arms across her chest. She waited. The helicopter came in slower than the first one. It flared. It settled. The door slid open. A man stepped out. He was tall. He was in his late 40s. He was not in dress uniform. He was in a plain flight suit with no name tape and no rank insignia because people at his level did not always wear name tapes and did not always wear rank insignia. And he walked across the pad toward her the way a man walks who has walked across a lot of pads toward a lot of people and has learned to take his time. He stopped 6 feet away. He took off his sunglasses. His eyes were bluish and they were very tired and they were glassy in a way that had nothing to do with the wind. Knox. Commander. It's just Ethan now. I'm out. Since when? 18 months. Huh. Yeah. They stood there. He looked at her. She looked at him. Neither of them moved. You saved Danny, he said. Park saved Danny. You saved Danny Knox. I watched the video on the plane. I watched it 4 times. Don't tell me Park saved Danny. I did my job. Yeah. His voice was rough. You did. You did your job. That's what you always did. That's what we always, that's. He stopped. He pressed the heel of his hand against his eye for half a second. Ward. Yeah. Why are you really here? He lowered his hand. Because when we lost Hamid and the others in 2014, he said you disappeared. You walked out of the hospital in Landstuhl and you never picked up a phone again. And I spent 6 years wondering if you were alive. And today I was in a meeting in Tampa and my phone rang and it was James Holloway and he was crying Knox. James Holloway was crying and he said your name and I got up from the table and I got on a plane because I needed to stand in front of you and see with my own 2 eyes that you were alive. She did not answer. Her eyes filled up. She did not let them spill. I'm alive, Ethan. I see that. I'm sorry. Don't. I should have called. Don't, Knox. Don't. I'm not here for that. I'm not here for an apology. I'm here because my brother's boy is in an operating room downstairs because of you and because Danny is, he couldn't finish. She stepped forward. She closed the 6 feet. She put her arms around a man she had not seen in 6 years, and Commander Ethan Ward, who had once pulled a piece of shrapnel out of his own thigh with a leather man in the back of a truck in Kandahar, put his forehead against Avery Knox's shoulder and held on to her the way a brother holds on to the only sister he has ever had. They stood on the roof of St. Gabriel Medical Center for a long time. Neither of them said anything. And down on the ground floor in the lobby, the first news van had just pulled up to the curb. The news van was the first. By the time Avery and Ethan came back down off the roof, there were 4. By the time she walked past the lobby on her way to the ICU to check on Danny, there were 7, and a local reporter with a microphone was already trying to push through the revolving door, and hospital security was physically holding her back. Avery did not look at them. Ethan walked on her left. He had put his sunglasses back on. He did not look at them either. How many of those are there going to be by tonight? She said quietly. All of them. All of them. Knox, the video has 31 million views. CNN led with it at noon. You're the top story. Ethan? Yeah. I'm going to throw up. No, you're not. I think I might. You survived Anbar. You survived Kandahar. You can survive Good Morning America. She let out a breath that was almost a laugh. They kept walking. At the ICU doors, Dr. Park was waiting. Her cap was off. Her hair was up in a loose bun. She looked like a person who had been standing for too many hours and had forgotten where her own legs stopped. He's waking up, she said. Avery stopped. He's what? He's waking up Knox. He's not all the way there, but he opened his eyes 5 minutes ago, and he asked for his dad, and he asked for his grandma, and then he asked for you. In that order. I thought you'd want to know. Avery stared at her. Park. Go, he's in Bay 2. I already told the nurses you're coming. Avery looked at Ethan. Go, he said. I'll wait. She went. She pushed through the ICU doors. She walked past the bank of monitors. She walked past a nurse who looked up and saw her and did not say a single word because the nurse had seen the video too, and because there are some people you do not make small talk with in a hallway. She stopped at the foot of the bed. Danny Holloway was 20 years old and he was pale as milk, and he had a ventilator tube taped to the side of his mouth and an arterial line in his wrist and an IV in each arm, and his right leg under the sheet was a shape that ended where it shouldn't have ended, but the shape was still there, and the shape was the thing that mattered. His eyes were half open. They found her face. A tear ran down the side of his nose. She walked up to the head of the bed. She put her hand over his hand. She leaned down so her face was close to his. "Hey, buddy." His fingers moved, just barely. They closed around hers. "I told you," she whispered. "I told you I'd fix you." His eyes closed. They opened. They closed again. His mouth moved around the tube. He couldn't speak. He didn't need to. She put her forehead against his forehead. She held it there for a long moment. "You sleep now, Danny. You sleep. I got you. I got you, baby. I got you." She straightened. She wiped her face with the back of her wrist. She squeezed his hand one more time. She walked out of the bay, past the nurse, past the monitors, and back through the ICU doors. Ethan was waiting exactly where she'd left him. He did not ask. He did not need to. He saw her face and he knew. They walked back down the corridor together, and halfway down it, Hoffman was waiting for them. He had changed ties. He looked like a man who had been told in the last hour that his life was going to be different from now on and was trying to decide what to do with his shoes. "Ms. Knox." "Sir, there are a lot of people downstairs." "I know." "The Secretary of Defense called." "I know. He wants you in Washington. He wants you at a ceremony. He wants..." "Sir." "Yes." "I'm not going." Hoffman's face did not change. He had somewhere between the third phone call and the fourth decided that he was not going to be surprised by anything Avery Knox did for the rest of the day. "I see. Sir, with respect, I came here for a job, a nursing job, on your ER floor. I still want that job. If you will let me have it, I would like to report to Melissa Harper tomorrow morning at 7 o'clock and fold linens and walk old men to surgical holding and do exactly what the schedule says I do. That is what I want. Sir, I do not want a ceremony. I do not want a promotion. I do not want a speech. I do not want a photograph. I want a locker and a name tag and a shift." Hoffman was quiet for a long moment. "Miss Knox." "Yes, sir." "You understand that is going to be very difficult to give you after today. There are cameras in my lobby. There are going to be cameras in my lobby tomorrow. There are going to be cameras in my lobby next week." "I understand." "You will not be able to walk into this building without being photographed for a very long time." "I understand. And you still want the job?" "Yes, sir, I still want the job." Hoffman looked at her. He looked at her for a long time, and then very slowly he nodded. "Then you have it." "Thank you, sir. One condition." She waited. "I am giving you a 30-day leave of absence, paid, starting tomorrow. Not because you need it, not because you deserve it, although you do, but because if you walk into my ER tomorrow morning, I will not be able to protect you from what is waiting out there. And I think the woman who just saved Danny Holloway deserves 30 days to be a human being before she goes back to being a nurse." She almost argued. She saw his face and she didn't. 30 days. 30 days, and Knox, well, "Sir, when you come back, you are not on linens. You are on the trauma team. I talked to Patel. I talked to Park. I talked to the chief of nursing. There is not a single person in this building who is going to argue with me on this. We are going to build a position around you. You will have final say on what that position is, but you will not be folding sheets in my hospital, ma'am. I'm sorry, I cannot do that. Not after today." She looked at the floor. She nodded. "Yes, sir." "Thank you, Ms. Knox." "Thank you, Mr. Hoffman." He held out his hand. She shook it. So the 30 days went by in a way that later, when she tried to remember them, she could not quite put in order. Her mother came. Her mother stayed. Her mother made chicken soup in a pot Avery had not taken out of its box since she'd moved in. Her mother sat on the couch at night with her quilt over her knees and a cup of decaf coffee in her hand, and she watched her daughter sleep for the first 4 nights in a row because her daughter was finally sleeping. Ethan came by twice. He brought a case of beer once and a pizza once, and both times he sat at her kitchen counter and did not say very much because he was not a man who needed to fill silence, and she was not a woman who needed him to. Danny Holloway woke up on day 3. He stayed in the hospital for 19 days. On day 20, they moved him to a rehab facility in North Carolina closer to his grandmother. On day 21, Elma Holloway flew up from Alabama, and Avery Knox met her in the lobby of a hotel in town, and the first thing the 71-year-old woman did before she said a single word was put her arms around Avery and hold on. They sat in the hotel restaurant for 2 hours. Elma Holloway did not let go of her hand the whole time. She told stories about Danny, about the bakery he wanted to open, about the cinnamon rolls, about the Hershey bars he used to steal out of the pantry when he was 8, about the day he came home and told her he'd enlisted and how she had not spoken to him for 3 days because she had been so angry, and how he had come into her kitchen on the 4th day and said, "Grandma, please, please look at me," and how she had looked at him, and how in that moment she had known she was going to spend the rest of her life being afraid, and how today was the first day in 3 years she had not been afraid, and that was because of Avery. Avery cried quietly into a dinner napkin. Elma took the napkin from her and gave her a clean one from her own purse. "Honey?" "Yes, ma'am?" "My grandson said to tell you something." "Okay." "He said to tell you that when he opens that bakery, there's going to be a chair in the corner with your name on it. And the cinnamon rolls are free for life, and you don't get to say no." Avery laughed. She laughed through the tears. "Yes, ma'am. And I'm going to hold you to that, Avery Knox. You hear me? I'm going to hold you to it." "Yes, ma'am." On day 24, she got a phone call from a number she did not recognize. She almost didn't answer. She did. "Avery Knox." "Knox, James Holloway." "Sir, I'm not going to keep you. I know you've been getting a lot of calls. I just wanted to say one thing to you and then I'll let you go." "Sir, I tried to figure out in the last 3 weeks what the right way was to thank you. And every way I tried to do it, you turned it down. You turned down the ceremony. You turned down the medal. You turned down the television appearance. You turned down the call from the vice president. Sir, Knox, I'm not mad. I understand. I understand better than most. So I figured out the one thing you wouldn't turn down, which is, Danny is alive." Her eyes closed. "Yes, sir. Danny is alive because of you. And the only thing I can give you, the only thing any of us can ever give you, Knox, is that fact, that he is alive, that he is going to walk down an aisle one day, that he is going to have children, that he is going to make his grandma those cinnamon rolls, that he is going to grow old. That is the thank you, Knox. I can't give you a medal big enough. I can't give you a ribbon long enough. I can only give you a boy alive going forward because of you, and I hope that's enough." She couldn't speak. "Knox." "Sir, is it enough?" "Yes, sir." "Good. Captain?" "Yes." "Tell Danny I said hi." "I will." The line went quiet. Neither of them hung up for a second. Then he did. On day 29, she sat down with her mother at the kitchen table. She had a cup of coffee in front of her. Her mother had a cup of tea. "Mama." "Yes, baby." "I go back tomorrow." "I know. Are you going to stay?" "For a little while longer, if that's all right." "It's all right, and good." They drank in silence for a minute. Then her mother said quietly, "Are you scared?" "A little." "Of what?" "Of being her again. Of being the one they call, of being in the middle of it. I came here to stop Mama. I came here to be small. And now you're not small." "No." "Avery." "Yes, Mama." "Maul was never your size." Avery looked up. Her mother reached across the table and took her hand. "Baby, you are not the kind of person who gets to be small. You tried. I watched you try for 6 years, and I am so proud of you for trying. And I am also glad, in a way I know you don't want to hear, that you are done trying, because the world needs what you are, Avery. And hiding what you are was costing you more than being what you are ever did." Avery did not answer for a long moment. Then she said, "Mama." "Yes." "Okay. Okay. Okay." Her mother squeezed her hand. "Then tomorrow, baby, you go." She walked into St. Gabriel Medical Center at 5:43 in the morning, 17 minutes before her shift officially began. The same receptionist was at the front desk, the same reading glasses on the same beaded chain. The receptionist looked up. This time she did not look down again. "Welcome back, Ms. Knox. Good morning. You have a name tag waiting for you. And a card from me. It's nothing fancy. It's just a card." Avery took the card. She put it in her pocket. "Thank you. Ms. Knox?" "Yes." The receptionist's voice went unsteady for the first time in probably a decade. "My husband was at Khe Sanh, 1968. He doesn't talk about it. He never has. But he watched your video, and he watched it again. And last week, Ms. Knox, he talked. For the first time in 57 years, he talked. He told me about a medic who crawled across a rice paddy to get to him, and he cried, and I cried. And I just wanted you to know. That's all. Avery stood very still. Ma'am, yes. What's your husband's name? Harold? Will you tell Harold something for me? Yes. Tell him that medic thought about him every night for the rest of her life. I promise you, I promise. Every medic thinks about everyone. We don't stop, not ever. You tell him that. The receptionist pressed both hands against her mouth. Avery walked past the desk. The ER was already busy. The ER was always already busy. A man was vomiting in Bay 1, a child was crying in Bay 4. Dr. Patel was at the nurse's station with a chart in his hand, and when he looked up and saw her, he smiled the small, tired, real smile of a man who had been hoping for 29 days that she was going to come back. Knox. Rick. You're early. 17 minutes. Sounds about right. Melissa was at the end of the counter. She had a clipboard in one hand and a coffee in the other, and she had a new lanyard around her neck that Avery had not seen before. It had a silver pin on it. Avery squinted. The pin said Trauma Liaison. Melissa. Knox. New lanyard. New job. Hoffman made it up. I think he made it up specifically to have a reason to pay me more. Melissa's mouth twitched. I suspect he did it because he thought you'd be easier to manage if I had a title. He's not wrong. He's not wrong. They looked at each other. Knox. Yeah. You ready? Yeah. Trauma Bay 1 in 10 minutes. We have a motorcycle accident coming in. Compound fracture. Probable internal. Patel is taking lead. You're second on the bed. Copy? Knox. Yeah. It's good to have you back. It's good to be back. Avery walked down the hall toward the locker room. She pushed open the door. She went to her locker. She opened it. She reached for a fresh scrub top. And she stopped. Because the photograph inside the door, the old photograph, the one with the 4 people in desert fatigues in front of a Humvee, was no longer alone. Somebody had taped a second photograph next to it. A new one. A Polaroid. Still warm at the edges like it had been developed that morning. It was Danny Holloway. He was sitting up in a hospital bed. He was pale, but he was smiling. He was giving a thumbs up. And written across the white border at the bottom in a young man's shaky handwriting were 4 words. Thank you. Danny. Avery put her hand on the photograph. She stood there for a long moment. Then she closed her locker. She tied her hair back. She put her stethoscope around her neck. She walked out of the locker room. She walked down the hall. Her shoes did not make a sound on the floor. She walked to Trauma Bay 1, and she stood at the foot of the bed with her hands folded in front of her, and in the distance, far, far down the hallway, past the doors, past the lobby, out on the ambulance ramp, the sound of a siren was starting to rise. She lifted her head. She listened. She was ready. Knox had come home.